there's been a lot of concern about hantavirus and whether it could become the next global health threat.
Joining us now to help break down what people should know about the virus is Professor of Epidemiology at the UCLA Fielding School of Public Health and Director for the Center for Public Global Health Security is Dr. Anne Rimoin. Welcome back. We never like to see you because that's not good news, but we're so grateful to have you to help explain, because I think many people, and especially younger people who've grown up in the COVID generation, have been especially concerned to see people in these masks again, to hear about transmission, to hear about quarantine. So maybe you can help sort of explain all of this. What is hantavirus, and what is happening abroad versus what's happening here in the U.S.?
Well, thanks for having me, and I'm glad to be able to explain this, because I think that there's a lot of confusion about what we are seeing overseas with this outbreak that's happening on a cruise ship, that now we have people quarantining all over the world, versus hantavirus in the United States. So hantavirus is actually, it's a family of viruses, and they are distributed all over the world. So we have hantaviruses everywhere. The hantavirus outbreak that we're seeing right now that the world is talking about is the Andes virus. And this virus is in particular a unique hantavirus because it's the only one known to spread from person to person. And that's what makes it particularly nerve-wracking for everybody. And that's why the fact that it happened on a cruise ship, which is a place where viruses spread really easily. I mean, right now we have 2 big outbreaks of norovirus on cruise ships all around the world. So that's not unusual. We know they spread easily. Hantavirus here in California, in the United States, that's the sin nombre virus. And that virus is different. It's not known to spread from person to person, but people get it from sweeping rodent droppings and urine, and it aerosolizes it, and then individuals can get it, but they don't tend to spread it from person to person.
So that's different from what we've seen on this cruise ship.
Exactly.
Where you talked about where the virus is typically found and how it spreads normally, which is what we're experiencing now, which is slightly different, what you're talking about. So what symptoms should people watch out for, and when should someone seek medical advice? Because I would imagine there are people going, do I have it? Do I, is this unusual?
Right. So what I would say is, in terms of what's happening globally, this is not something that your average person should be worried about that's, here in Los Angeles. If you've had exposure to somebody who is one of the cases of this outbreak, that's a very different story, and you're being quarantined, monitored by local health authorities. That they've been very good about doing the contact tracing and making that happen. Now, for hantavirus, practical information for people here in California, because we do have cases, rare, but we do have them, is you should, if you've been in close contact with places where you've been sweeping out, where there have been rodents, and then a couple weeks later you get sick. If you're seeing your doctor, I would definitely note that you've had those exposures so that they can keep that in mind. But it is very rare. I mean, we've had usually about 3 cases a year here in California, but it's something that does happen. And so we just want to make sure, if you are near rodent droppings, you're going to sweep things up, you want to do it wet so it doesn't aerosolize up, and that's how people get it.
And we know they're doing a terrific job of quarantining in the middle of the country, many of the American patients who've come back. We've also heard, though, and reported that a number of people from California have been affected by this, and I think that some people here are starting to wonder, oh, does that mean it has come to California? Is there any risk that these people who are on the ship, who are from California, who have returned home, could they be patients who might spread it?
So the people that are in California are being monitored by the local and state departments of health. And so they will be checking in every single day, monitoring temperature, making sure, tracking symptoms, and making sure that they're staying away from, close contacts. And this virus is not usually something that is spread from person to person. It does, there are definitely occasions that it's happened, and so that's why people are being watched very carefully. So with good quarantine, that's not something that we're particularly worried about. So something to be concerned about globally. We know that viruses spread. It's really important topic, and things that we worry about that have high consequence for the people that are directly involved don't necessarily mean next global pandemic.
Right.
For people that have summer travel plans, maybe they're going on a cruise, is there anything that they should be concerned about?
Well, you know, cruise ship, I would not be concerned about something like this happening. I think this is a kind of a fluke situation, very unfortunate that a very infectious virus that can spread from person to person got onto that has a high mortality rate, got onto this cruise ship. But you know, if you're going on a cruise, remember that infectious diseases do spread easily. I would worry about things like norovirus, other gastrointestinal things, or even respiratory viruses. And that's because, you know, cruise ships, there's so many people intermixing, small spaces, people coming off and on the ship, buffets, it's kind of all of those, you know, lots of touch points where lots of people are touching things. So it's just an easy place for viruses to spread. So what I would say is if I were going on a cruise, I would make sure to be washing my hands regularly, not touching my face. You know, I would try and do more things outside than inside if you can. You know, those are the things that I would pay attention to.
I would love to go on a cruise with her. Where Dr. Rimoin is like, no, we're not going to do that. We're not going over there.
Buffet? I don't think so.
Yeah, no, that's exactly.
Well,
Thanks,
again,
Dr. Rimoin.
yeah, we really do appreciate your
My
insight, as always. Dr. Anne Rimoin, Professor of Epidemiology, UCLA Fielding School of Public Health, and Director of the Center for Global Health Security. You can follow her on X at @Rimoin or Instagram at Anne Rimoin.
Great information. A lot of people worried and talking
Yes,
about it. So
yes.
thanks for putting things into perspective.